Hello, I'm Dr. Ian Strawford and I'm the Medical Director of Skin Excellence Clinics, and we're going to talk a little bit about psoriasis, the skin condition psoriasis, and how we can help you with one of our treatments at Skin Excellence Clinics.
Could you explain what psoriasis is?
So psoriasis is an autoimmune inflammatory skin condition. When we say autoimmune, we mean that this is where your body, unfortunately, is attacking an area of the body. This is what we see in autoimmune diseases. In this case, your body's immune system is attacking the skin.
What are the common symptoms?
So what happens with psoriasis is there's a chronic inflammation in the skin, which there's an overproduction of certain of the outer layers of the skin. So the typical symptoms that we get are usually inflammatory skin conditions. So you could see some patches of redness or soreness or irritation. This could be widespread over the whole body, and that's called gut A psoriasis. Or it could be localized to certain areas, typically the arms or the legs or the limbs. It could be even the scalp. And in some of those localized areas, you get the buildup of what we call these inflammatory plaques. So the skin gets thicker and thicker and thicker. It can look silvery and scaly and loose, and it gets very thick and unsightly. So a lot of our patients are really, really distressed by the physical appearance of psoriasis, as well as the sort of inflammatory, irritable, irritation type symptoms. Particularly in the scalp, it's often misdiagnosed as psoriasis because the scales fall off in the scalp and look like dandruff, but there's often chronic redness and soreness of the scalp as well.
How is psoriasis managed?
Psoriasis is a chronic condition which needs to be managed. How is it managed? Well, often patients will be seeing their GP and they may be being prescribed some topical treatments or emollients or special shampoos if it's affecting the hair, which are all important to try and help control some of the symptoms of psoriasis. You may, if in severe cases, be referred to a dermatologist, a consultant dermatologist at the hospital, because there are some very high-powered immune suppressant drugs now that can be prescribed that can really reverse and halt the progress of psoriasis. These are very powerful immune-regulating drugs, again, only prescribed through a hospital setting in most cases, because they can have quite serious side effects associated with them. There is a physical treatment that we do at some things we do at Skin Excellence Clinics to help people with psoriasis. The most popular treatment that we use is called LED photobiomodulation or LED phototherapy. And one of the particular wavelengths of light from our machine, which is near infrared light, you can't see it, it passes deep into the tissues, into the skin, can reverse those inflammatory pathways. So we can reverse the changes that are happening with psoriasis if it's not too severe. And so we can treat localized areas with the LED, with the Tri-Wave MD. It can be quite effective on the scalp. It can be effective on small plaques of areas, which could be on the arms. The limitation really from it is the size of the areas that we can treat. Okay. Prior to that, the only treatment that was available to treat larger areas is called PUVA, which is ultraviolet therapy, UV therapy, which can be very effective, and why quite a lot of patients with psoriasis find that if they expose the skin with psoriasis to the sun, it gets better. But then we have a risk problem because we're increasing the risk of not only skin aging, but more importantly, skin cancer. So PUVA therapy, UV light, is going to increase your risk of skin cancers as a secondary consequence of that treatment. The other thing we consider with psoriasis, as we do with a lot of our patients who might have autoimmune diseases, is to look at the health and well-being of the patient from a nutritional, metabolic point of view, looking at whether they have high levels of inflammation in the body, where that might be coming from. Is it the gut microbiome? Are they deficient in omega-3? Do they need certain supplementation? Do they need to look at changing their diet or their lifestyle? So we can assess for all that through our advanced blood testing, DNA testing and the like that we do, what we call health optimization or longevity medicine side of our practice. That often patients can find some valuable insights and support they can do themselves to try and help control their psoriasis. I just want to reiterate the Dermalux Tri-Wave MD system that we have is a clinical medical LED photobiomodulation system. There are lots of systems out there, home use ones, masks, things that deliver sometimes very inferior or low level power. Certainly that is not going to be sufficient to treat psoriasis. And actually the Tri-Wave MD is the only system worldwide that has been approved or licensed, so to speak, by the FDA, the American Federal Drugs Agency, which is the most critical licensing agency in the world, to be the only system of photobiomodulation or LED that is approved for the use to treat psoriasis.